on the 7-day forecast. Also talking the chances for sticking snow. The chances when I come back.
Well, it's one of the most common side effects of the colds and viruses that are going around these days.
13 ABC's Melissa Vage telling us what it is in this week's What's Going Around.
Well, Lee and Diane, we're talking about ear infections. While it's predominantly a childhood issue, it is hitting more and more adults. And it's going around at doctors' offices this week. 1-year-old Lucas is happy now, but it's been a long couple of days for his mother, Madison.
He's got kind of like a cough. He's had a fever the past couple of days, and he's been pulling it at his ears.
While bacteria can cause ear infections, ProMedica Dr. Eugene Izsak says a virus can trigger one as well.
80% of ear infections will be gone in 5 days without antibiotics.
Which is why it's so important to get a doctor's check for infections.
One of the problems we have in the United States is overtreatment of ear infections or giving children antibiotics who don't really need it.
Aside from putting a heating pad on to relieve the pain, there is little you can do at home to cure an ear infection.
It's okay to use acetaminophen or Tylenol, ibuprofen or Motrin for pain relief, and then the child needs to be seen.
The challenge this time of year is that it's cold and flu season, and very often kids and adults will get an ear infection as a secondary problem, along with sinuses.
If there's ear discharge and the parents don't know where that's coming from, that needs to be seen also.
Letting ear infections go unchecked can cause problems.
We do know that children with chronic and recurrent ear infections and children with chronic and recurrent fluid in the middle ear can certainly cause hearing deficits.
All right, I also want to give you an update on the flu. We're trying to get you a weekly update. We have 3 flu-related hospitalizations. Nationwide, though, we are starting to see the flu activity pick up a little bit. We've even had a report of a young woman from the Phoenix area, 20 years old, who died from flu complications. So it is still recommended that you get a flu shot. Very strong strains this year. Reporting live, Melissa Vage, 13 ABC Action News. Back to you.
All new at 5 o'clock, there's a growing demand in the food industry for